Hello and welcome to this video about control of pain is so difficult. So in this video today I'm going to be addressing, what is going on here? What's the bigger picture of what's going on here about being in a situation of serious pain or any pain at all, and being controlled by your pain, being affected by your pain, being woken up by your pain, and trying to manage that, trying to live your life around or dealing with or being dominated by your pain. And that's an extremely challenging situation, when we're in chronic pain and it's just overwhelming and overtaking our lives. Everything's affected. Your energy levels obviously are going to be affected, and our moods, the way you behave to others and how you feel, because you're coming from a very uncomfortable position and place, and you're trying to function your life around despite dealing with the pain that you're in, the conditions that you're dealing with. So let's step back from this whole situation and just look at things. What's going on with we're trying to control the pain, controlling it through however you do. So typically what happens, especially in this country, is that we develop a symptom, we get into trouble with some kind of condition, something rises up, something develops within us, and very often we might have noticed signs and signals of what's going on for many months, for many years even. And eventually get yourself to the doctors, and they might hopefully diagnose what's going on. So not always, but hopefully you get a diagnosis, and then you get medication to deal with that. And perhaps it works and perhaps it doesn't. Maybe it crops up a bit later, and off you go to the doctor again with some side effect or secondary symptom, or something else has cropped up, and they'll give you medication again, diagnose your thing, medication. And this is the normal pattern of things in the Western world, in the Western idea that something's wrong with your body. You have a symptom, you have a thing, fix it, cut it out, blitz it with medication, fix it, sort it out. That will be fine if it works. If it works every time, and we know it works, and it works. You wouldn't be watching this if it works, would you? You wouldn't be looking for complementary medicines of any sort. Your doctor works, get the medicine, done deal. But it doesn't, does it? And so that is the first step of seeing things as getting sick, or maybe something's crept up on you, having a symptom, going to the doctor, going down the doctor route, medication, perhaps operations, specialists, going down that route. So stepping back away from this, I want you to look at things from a bigger perspective. And once we start looking at things from why they got there, how they got there, why has this thing developed in you, in your body, why are you now dealing with this, what's going on for you, what's the bigger picture, what's led up to this? We start to look at the real causes, the root causes, and that's where the area of healing really happens. You might be able to soothe your thing or help your thing to a certain degree, but unless you address the root causes and the reasons that's developed the thing in the first place for you, it's just like heading a weed. You're taking off the top of the plant and not pulling the roots. That plant is just going to pop up somewhere else. Lights, camera. That plant is going to pop up somewhere else if you don't pull the root. It was exactly the same with your pain, with your symptoms. And just because we've been ingrained to understand that we have a thing, we go to the doctor, get it fixed with medication. It doesn't have to be that way. And the fact that you're looking at this tells me, you've gone down that route possibly and not been satisfied with the results. You still are suffering with your thing, and you're looking to sort it out. So let's have a little analogy here. If you think about a seesaw and the seesaw's tipping off the kids and it's all wonky, we don't address the wonkiness. We don't tell off the kids. We think, oh, it's a wonky thing. It's something's not working, isn't it? Maybe let's have a closer look. Let's look into maybe the structure of it. It's not quite. Maybe it's not very safe, is it? That seesaw. And we notice that one of the bolts are loose. That's what the problem is, isn't it? So we go in and we fix that bolt of the seesaw, and it gets working fine again. Just like comparing it to someone's body, if we have a problem with perhaps the joint or the ligaments, the muscles. So let's have a look at something that's really common for most people as bad back, having a bad back. Well, the first thing we do, what do? We notice it. We have the problem in our back, and then we do something that is immediately relieving. We might put our hand there. We might sit down. We might rub it. We might put a cold pack or a hot water bottle. We might do something that's immediately relieving, and that will be fine. Maybe the back pain goes away. Great, that's fixed, that's done and sorted, off you go in your life. But what if that back pain keeps coming back? What if that bolt in the seesaw keeps getting loose? Well, then we start questioning things, don't we? We naturally will start to think, well, why have I got back pain? And maybe it's that thing, and maybe I stood so long the other day, or maybe I got overloaded and things are too much for me and I'm feeling it in my body. We start looking deeper, we start questioning what's actually creating that problem, and we start tapping into the root cause, and that's where the real key is of healing. I can show you with the PainFree method how to get instant relief, which is great, but it's really when you tap into what's creating the pain in the first place is when you get the full-on results, and the pain never comes back again, because you're removing the reason it's there in the first place. So coming back to our seesaw, and you're on the seesaw, aren't you? And you discover the bolt. The bolt is, you replaced it, but it's going wrong again. Well, that's not the real problem, is it? That's something else going on there. Maybe the seesaw hasn't been aligned properly in the ground. Maybe it's a bit loose, or perhaps the ground is loose. It's made of the wrong materials, sand instead of concrete or something. And we dig deeper when we don't solve the problem. Sorry about the light. When we don't solve the problem or it keeps coming back, we naturally will go deeper and deeper. And we don't stay on the bolt, do we? We don't blindly stick on the bolt, stubbornly stick on the bolt, this the bolt, keep changing the bolt, and we end up changing the bolt 5 more times. But by this time, the seesaw's broken into bits, keeps getting played on, and the soil is softening, and it's unusable after 5 times. Well, we'd have missed the point. We'd have missed that lesson and that understanding, and not got the right answer for the problem that was presenting itself. So coming back to your back, or someone's back in pain, we may have initially fixed it with a nice warm hand, hot water bottle, a nice warm bath or something, but the back pain keeps coming back. So we start addressing the deeper meaning of what's it doing there in the first place. How did it develop? How did I get this bad back? And put in this bad back blank the thing that you're dealing with, the endometriosis, the fibromyalgia, plantar fasciitis, headaches, stress, whatever you're dealing with. Put in that position change the bad back for your thing. And if it's chronic pain, things that have developed and got worse and increased or not gone, they are more signals for you to pay attention to understand what's going on, so you can get rid of it. So we start looking at, well, how have I got this thing? Maybe it's hereditary. Maybe it's a condition in this part of the world with this situation. That's why I've got it. But whatever it is, we start naturally digging deeper at the original cause of why you've got your thing, don't we? It's natural human nature. And that's where the problem with going to the doctor and going down that route, why it never gets healed and fixed, because it's not addressing. Maybe you've got a great doctor, maybe they're doing a good job there, but they're not trained to look at the root cause. They're trained to look at the symptom and give you medication for that and down that route. So the real pain relief and the release of your symptom comes from understanding, fully connecting with your root cause of your thing. So can you see how when we address the root cause, that there's no reason for your symptoms to be there in the first place? It might be hard to believe that your symptoms will go. Some people can't believe that that's going to happen for them. But can you see the principle at least? Can you see how when you address the root cause and what created it, whatever that is, on whatever level, whatever reason it is, when you address the root cause and unpluck that root cause, then there's no reason for your body to develop into any symptoms at all. Do you see how that that can work? Because that's the first stage. Just to be open. You don't have to believe this method. I don't expect you to. You know, it's a new method. I developed it, but it comes from how our bodies work. So I just want you. All you need to do is just be open to the possibility of, what have you got to lose? You know, I understand that you're here because you're looking for relief from your pain. So suspend disbelief if you have any disbelief, and trust your instincts, trust your own body, and let me take you into stage. The second two questions I asked for this video, you know, how are you going to get back to control? Your body, your symptoms have been overwhelming and controlling you. Let's get the control back and get you back in charge of your body, of your situation. And so the healing can happen and get that started. So the way to have that happen, get yourself back into control, is what normally happens when we have pain is we end up reacting to it. We end up wincing and having side effects from it, maybe taking medication, or some people try to just push through it and try to ignore it and get through the day, get on with their lives. They push through. We react to it, react to the pain. We might limp, we might do things that help us get on with our day, to get bypass the sensations we're feeling. But sometimes even that's too much, isn't it? Sometimes it just completely wipes us out. We can't think straight, we can't sleep, we can't function, we can't even go shopping and just normal everyday things. And so the way to get back in control is to face your dragon. Face your dragon. I call it the dragon because it can be pretty horrendous, right? And can feel like you're the slave of your symptoms. But I want to put you squarely in the control position and the in-charge position, and to ask you to face your dragon. And I understand this might not be easy, this might be very challenging, but I encourage you to do it anyway. What have you got to lose? To face your dragon. So when the pain arises, whether it's a very mild pain right now, or non-existent even, hopefully, that'd be good, or whether you're in the full pelt of your symptoms right now, I ask you to connect and stand face on to your dragon, and to feel into what you're sensing. So when I gave birth to my children, I went through the contractions. And forgive me if you're a fella, but put yourself in the position of your symptoms when your symptoms overtake you and do what they do to you. These contractions, the first one I had was so overwhelming I could barely breathe, and I was just hoping it wasn't going to last too long so I can get my breath back and breathe. And it completely overtook my body. And then I remember my techniques. And the second contraction came over me, and this time I sat in the middle of that contraction. I like riding a wave, right? I rode the wave of the pain, of the overwhelming pain, all-consuming pain, and breathe deeply and slowly as I did that. And the experience was, although the pain essentially was the same, my experience of it was completely different. It was like being crashed and bashed over with a wave and completely lost control and completely overwhelmed, to the second contraction, which was like riding, like I'm on the crest of the wave, almost exciting, almost like an ecstasy. And I knew in the back of my mind this was a normal experience and something that must happen to get my baby out. So whatever you're dealing with, no matter what, and I've seen everything from headaches to full-on cancer, no matter what you're dealing with, I promise you this is a normal reaction of your body. It's a normal thing to take place, even though it might be a dreadful experience. I ask you to face your dragon, to breathe deeply, to be in the center of that consumption of your pain, to, if it's a back pain or a knee pain, whatever's you're experiencing, if it's an all-over body thing, breathe deep and slow, force your body to breathe deep and slow, and to face your dragon, to connect into the sensations you're experiencing, to connect into, be in the middle of that overwhelm, of that all-consuming wave of what you're experiencing. So this is how healing happens. This is how you're allowing the healing to take place. So just bear with me on that one for a moment. And to remind you that your body heals no matter what. Your body, given the opportunity and the situation and the right circumstances, will heal no matter what. And when we do take medication, it just moves the symptoms. In my experience of treating people, it interferes with the natural rhythms of your body. And your body heals. When you cut yourself, it bleeds, and you don't have to say, hey skin, heal, blood flow, clot, do you? It just does it. Your body knows what to do. It's ingrained. It's made to heal. It's made to be in balance at all times. And lots of things get in the way of natural balance and health and healing, natural health and good health. But given the opportunity, the body will always ping back into health. It's called homeostasis, how our body will always align given the opportunity. But lots of things take it off, and lots of little things take it off, and lots of big things take it off. Stresses and traumas and all sorts of things, lower immune systems, all sorts of things. So your body naturally will heal given the opportunity. And when the pain rises up in your body, it's like a message from your body showing you where the imbalance is. And your body doesn't need you to heal. It doesn't want that from you, from your mental attention. It doesn't need that from you. Your mind does mind things, doesn't it? Your mind thinks, your feelings feel, and your body bodies. Your body does body things. So your body already knows how to heal. It doesn't need that from you. What it needs from you in order to heal is your direct attention. It needs you to pay attention. It needs you to focus on what it's showing you. And you might find you have resistance to this or blocks that come up, and I'll talk about this just 1 second. But essentially, your body naturally flows. Imagine your body flows on like a electrical circuit, which it does actually, but imagine an electrical circuit. If that electrical circuit is broken in any part, the electricity won't flow. And it's exactly what happens when you get sick, when you get ill and you're in pain and discomfort, whether it's a joint pain or a heart condition or migraines, no matter what. If it doesn't feel good, there's a break in that circuitry. And your body will show up where the break is, where that break in flow is. And there are lots of reasons why illness happens, but essentially your body is showing up in the place that needs fixing. So then you come along and go to the doctors and pile drugs at it, or look for answers, or try to fix that thing, or get rid of it, or cut it out. And you're essentially attacking you're attacking the wound, you're attacking the place that needs love and attention. So when your body rises up with sickness, what it needs from you to heal is your mental attention, to pay attention to it, to connect to it, to feel into it, to feel the fullness of what you're experiencing in your physical body. And at the same time to breathe slow and deep. And the breathing is very important. It's like the oil in the car. Your engine might be a Lamborghini, you never know, might have it. And a super duper car, beautifully looked after, but if there's no oil in the car, it won't work and it'll jam up the engine and it's had it. So your breathing, your deep and slow breathing, as you pay attention to your pain and you experience the belly of the pain, the center of your pain, your deep slow breathing is the oil in the works. It allows the healing to happen. The body needs oxygen, it needs lymph, it needs the blood to flow around in a full, deep and peaceful way for it to fully heal and to have change happen in your system, in your body. So you do that by deep and slow breathing while paying attention to what you're experiencing. Okay, so this is how you get back the control and stop the pain overwhelming you and taking charge of your system and giving you a hard time and affecting your life. You face the dragon where it is. As it rises up, whether it's a small niggle or whether it's a full-on dose whacking you out for 3 days or a week, you meet the dragon where it is. You try to relax as best you can and breathe deep and slow as you do that. And you wait until your body is satisfied with the amount of attention you're giving it. And you know, if you've had your thing for a long time, you might need to have a little practice at this and keep going at it. But the moment you give your pain, your symptoms, the attention it needs, the full-on attention it needs, it will decline. It will what's the word I'm looking for? Recede. It will recede. And so you may or may not believe that, but it's in the experience of it. So give it a go. It does work, and trust yourself. Trust that this works. Make sure you're breathing deep and slow. Try to relax as you pay attention to the pain as it arises. And watch out for avoidance tactics like you haven't got time for this, or I don't know what I'm doing, or am I doing the right thing, or blocks that may come up. Jo found that when she was paying attention to the pain in her ankles that she was experiencing, when she connected with it, she found that she blocked herself. Anxiety rose up in her, and that stopped her going forwards. Well, if you find that anxiety or blocks or resistance comes up for you when you do this exercise, this practice, this pain-free practice, then you address what comes up for you, because that's what you need to be addressing. That's what's showing up in your system, whether it's anxiety like Jo, or whether disbelief perhaps come in, or skepticism might come in, or what's this got to do with my pain thing comes in, or whatever. You know, we're all different, we're all unique, so whatever comes up for you is what is the thing you need to be focusing on. And so if something rises up for you to stop the healing to release, then allow yourself to focus on that thing, the thing that rises within you. And blocks are not really blocks at all. They're moments of learning and acceptance of yourself, of loving yourself, of honouring yourself. And when you pay attention to what comes up for you, or what rises up for you, then the pain will release when it's good and ready. So be patient, pay attention to your pain as it arises, breathe deep and slow, and that will allow the space and attention for the pain to release, the symptoms to subside. That was the word I was looking for. Thank you, wherever that came from. And so give it a go. Suspend disbelief if you have any, and we'll just get on with it. And do let me know how you get on, and let me know your experience of this, what happened for you. And as you share your experiences, you're going to help other people too. And other people who will be watching this, and your experiences, how you take on this exercise, they'll get a good dose of it too, and it will help them to understand how to help themselves too. Okay, so thank you for joining me on this video. Give it a go, and do let me know how you got on.